Well, hello, everyone. This is Kyla Newland from Mountain Pacific Quality Health. Welcome to our next edition of It's Worth a Shot. Today for our presentation, we're going to be doing some immunization updates and also a couple of therapeutics updates that have come up in the last month or so. And then we'll have our excellent Crystal Morris presenting to us on what's new with Project Firstline. So let's go ahead and get started. I realized I have never actually introduced myself to this group, so I wanted to do that today. So I'm Kyla Newland. I'm a pharmacist. I did my training at University of Wyoming, and I am actually originally from Montana. So I do currently live in Alaska, but I have the needs and rural healthcare kind of intricacies in the back of my mind all the time, being familiar with all the states that you're doing all the great work that you do. Yes, go Pokes. All right, so we'll get started. As we always say, if you have ideas for upcoming topics that you'd like to see more information about, please pop those in chat, and we will continue to meet on a weekly basis on Wednesdays at the same time. Next slide, please. And we can go to the next slide, Mary. So one thing we wanted to start out with, I had previously done some education for this group about the updated pneumonia guidelines in adults with the approval of a couple new products. And Jesse had updated us a couple of weeks ago about the availability of some of these products in our states. So we did find out for sure that the Alaska immunization program is going to carry Prevnar 20 as kind of their preferred pneumonia vaccine. We haven't heard from the other states yet, but if anybody has more information on that, please do let us know. And just providing a couple, just reiterating a couple resources that we think are pretty valuable for looking at patients who might be candidates for pneumonia vaccine. There's the pneumococcal vaccine timing guide, which is a 4-page guide put out by the CDC. And then a new resource that we've actually developed here internally, and Jesse has done most of the work on that, is a standing orders resource guide that we're going to show you a preview of today, and we have that posted live. And I know that we're going to be distributing that to you folks so that you can use it in your facilities. And then I also wanted to mention a website that I find really useful for like more difficult questions related to immunizations. The immunize.org, there's a series called Ask the Experts. And if you go to the link, I believe Jesse's providing these in chat. Thank you so much. It's an excellent resource. There is so many answers to frequently asked questions and even kind of like more specific questions that might not come up as frequently. And so if you go to their Ask the Experts page, you can type in the search field, and it's really efficient at finding answers to common questions. So I'd encourage you to check that out. Next slide, please. So this is just a screenshot of page 1 of the standing order document that we have created. Basically, it's got all the recommendations for the folks that need this vaccine, which ones they need, the timing, the administration method, and then at the bottom of the document, there is a signature line for your medical director to sign that for your facility. So we've got the link in chat to that as well. That's live on our website. And if you need to get a copy of that, please feel free to reach out to us if you're not able to get it either one of those ways. And then we've also put a QR code on there, which is pretty cool. If you want to download the application, the Pneumo-Rex Vac, it's called, that will help you determine which pneumonia vaccine is appropriate for your patient. You can scan the QR code. It'll take you right to the page where you can download that on your phone. Next slide, please. So there's a few changes that came out as far as the recommendations for COVID-19 vaccines. This was just updated on the 20th. So we've newly seen that the booster dose is now recommended for children age 5 to 11. So that recommendation is following the previous recommendation. The adults get the booster doses, and now it's been extended to that pediatric population. Also, they changed the wording for the patients needing a second booster dose. And that if you remember from previous discussions on this call, it used to be you could or you may receive a second booster dose for these patients. They're 12 years and older, moderately or severely immunocompromised, or patients 50 years and older. So now they've changed that to a you should get this vaccine, and that's given the more recent evidence of the increased immunity when we give that second dose in these higher risk populations. They also updated guidance for patients who were receiving B-cell depleting therapies and may have received a COVID vaccine during that therapy. The difference here being now they're specifically recommending that those patients might need to repeat their primary series if they received the vaccine during one of these therapies. They also gave us some clarification for folks that have a history of MIS-C. So there's two different recommendations, one for pediatrics and one for adults that have a history of this syndrome. For the pediatric population, they said that they need to have 3 criteria to be able to qualify. One being clinical recovery being achieved and return to normal cardiac function at least 90 days after the diagnosis of MIS-C, and also the patient residing in an area where COVID-19 community level is high. And if you remember from, I think, our last session or the session before, there is a place where you can go on the CDC website to find out what your community level is by putting your zip code in there. So that's the recommendation for pediatrics, that they have to have those 3 things, or of course, at the discretion of their clinical care team. So that's a decision, a little bit more guidance on making that decision. And then for adults, they say it may be considered for adults at the discretion of their clinical care team without having those kind of 3 criteria present. But they do say that you want to make sure that they have returned to normal cardiac function and resolution of symptoms. Okay, so next slide, please. Another thing that's been updated a little bit as far as resources is some of the things I listed here. They now have a frequently asked questions and Mythbusters section of the CDC website related to COVID vaccines. There's a separate section for booster shots for each of the different age groups. So there's an adult section, and then there's a children and teen section. There's also, I think if you go to the first link just under booster shots, there's a tool where you can put in your specific patient characteristics and history of what you've gotten for vaccines and risk factors, and it'll tell you if you're a candidate to get a booster dose. So that's kind of nice. And then there's a section on up-to-date recommendations, and just posted yesterday this at-a-glance vaccine schedule, which is a 4-page document that kind of simplifies. It has really nice visual features. It's kind of got circles where you can see based on your age group and risk factors, what schedule is appropriate for you and which vaccine is appropriate for you based on your age. Next slide, please. So last but not least, some therapeutics updates. So the CDC came out with this health advisory a couple of weeks ago. Basically, in this health advisory, they are just reiterating the fact that there are oral treatments readily available to treat outpatient COVID-19, and that steroids and antibiotics are not preferred treatment in patients that are not receiving oxygen therapy. Instead, we should be looking at some of our oral agents like Paxlovid is primarily recommended, and then alternatively molnupiravir. And then we do have remdesivir also as an option in the monoclonal antibody, the one that's still indicated for the strain that we're seeing right now. So that's just a good resource guide, kind of reminding folks about about outpatient therapies for COVID-19. And then also a link to the full treatment guidelines. And that includes hospitalized and no, that's just non-hospitalized, the link that I provided for that. And then there's a couple other things that came up that I don't have on my slide, but I did want to mention. There was a recent, and I think it was yesterday or the day before, it was in the last few days. You may have heard in the news or elsewhere that Paxlovid, which is a 5-day therapy, oral therapy for treatment of COVID-19, they're seeing rebound symptoms after this 5-day course. And so it sounds like there was some back and forth where maybe potentially the manufacturer said maybe you should extend therapy beyond 5 days, but then the FDA came back and said, no, you know, this is not appropriate. We're still only recommending the 5 days. This is a phenomenon they actually saw in the trial in both the patients that were treated with Paxlovid and the patients that received placebo. So we don't yet know if this is directly related to the Paxlovid therapy or just kind of the epidemiology of COVID itself. So at this time, still need to stick to that 5-day course, even if you are seeing resurgence of symptoms. And then 2 other things, Paxlovid, there's been a little bit of talk around drug interactions as well. And so there's a nice guide that Jesse posted in the chat. It's a University of Michigan drug-drug interaction guide. And it has basically what drug they're taking and what action you need to take as far as can you still give Paxlovid or do you just need to stop? Another medication, for example, statins has been one of the ones that's come up pretty frequently. And in that case, you would just stop the statin for the 5 days and then you're able to restart therapy. But there's obviously other therapies that can't just be stopped abruptly like that. So that's a very good reference if you want to look at drug interactions. And then the FDA also put out a patient eligibility screening checklist. That's really nice too, if you want to take a look at that. One last thing about therapeutics that I will mention in my last couple of minutes. You may have heard or experienced a shortage in the marketplace of the concentrated albuterol inhalation solution. So that is kind of, it's a nationwide shortage. They're hoping to catch up on that by the end of June. And it is only in the 0.5% formulation, which is the higher concentration. It's not like the one that you would see usually in an outpatient setting. It's more for inpatient, more continuous nebulization therapy. So I'd be happy to take any questions. I know that was a lot of information. All right, well, I will go ahead and turn it over to Crystal. And if any other questions come up, feel free to stick them in chat. Thank you, everybody.
Thank you, Kyla. Hi, everyone. My name is Crystal Morse, and I am here in Wyoming today. And I am the contract owner for Project Firstline in Wyoming. So I wanted to share with you what's new. And thank you for having me back. I was here in March. And if you want to go to the next slide, Mary. This is what I presented in March, and I shared a link, and I want to apologize because I got my hand slapped by our communications team. So I shared a link that was internal for internal use only. And so I had people reach out to me and say, hey, Crystal, I signed up for your Why Firstline, your texting campaign, and I'm not receiving anything. Well, that would be why. So I'm sure when our communications team, I asked them, why aren't they getting these text messages that I had that emoji of, oh, my eyes were big and the Oh, that's why. So I wanted to get this on the screen one more time. And if you want to take your phone, you have to opt in by texting in. So there's no link that we can use. I apologize for that again. But if you want to text that the 205 number 5391, that Y first line, I'll give you a few seconds to do so. And again, we created this as a micro-learning tool. So what we are doing is you'll get twice a month, you'll get a 5-minute or less short burst of quick infection control training. And again, it's around why does contact time matter? What's the difference between cleaning and disinfection? Why ventilation matters? So again, we've really promoted it within nursing homes. We promoted it within environmental service staff. We promoted it within your onboarding of your CNAs. So this isn't going to be for your infection preventionists by any means. It's going to be for your case management, social workers, and your non-clinicians. So your dietary staff, this would be excellent for. So again, once you opt in, you'll get something that looks like this. And if you would go to the next slide. You'll get a text that looks like this. So you'll be asked your role, your workplace, and then again, we need your phone number, and it'll say Y first line. So you'll get something that says, just what it says on here, are you confused about SARS-CoV-2 and COVID-19? So in this episode, it will clear up your confusion and you will learn more. To simply opt out, you just type in stop and you won't receive any more text messages. Next slide, please, Mary. So kind of moving along is what I really wanted to come share with you all today is that we've implemented an infection control trainings through an escape room. And I'd love to hear from you if you have done an escape room and your experience. So if you would put into the chat function for me if you've done one. Yes, let me answer Brianna's. Yes, okay, Christine has done an escape room. Anyone else? Thank you, Jesse. And then you type the Y first line. Barb, you should get a response right away saying welcome. I did not get a response. I received, so Marcy said she received a response right away. So Marcy, Patty said she got one too, okay. So yes, you should get a response right away welcoming. And I believe that these slides will be sent out as well. I'm not sure why you're not getting a response, Diana. Are you typing the Y first line to that 307 number? Took about a minute, okay. No, you shouldn't have to be in Wyoming, Barb. Did you say you got a response, Barb?
Hey, Crystal, I didn't, but I'll keep trying.
Okay.
After you're done with your presentation. Thank you.
Okay, yep, yeah. All right.
Thank you.
Okay, so I saw in the chat where folks did do escape rooms. The experience, I hope you had fun with it because this is what the environment is. It's supposed to be a fun learning environment. The escape rooms were invented in the early 2000s. What they do is that they're critical thinking and your problem solving and it's a team-based approach. So when we did some beta testing, just as an example, we did beta testing within some FQHCs around the state and also through the community colleges. And we did it through, the FQHC was the last one I did, and I'll give you an example of the team. So it was a pharmacist, it was a nurse, it was an MA, it was the IT person, and it was the case manager. So those are very different disciplines. So again, it was a team-based approach. They all learned something and they all had fun. So next slide, please. So I want to kind of show you the outcomes, but before I do that, I'm going to have Mary stop sharing her screen so I can show you just a quick teaser of what the escape room looks like and how fun it really is. So this was a lift of, this was actually a quite heavy lift of 4 states. So Wyoming, Utah, New York, and New Jersey all got together, and we came up with a escape room that I'm going to share. So let me know when you can see my screen. Yep, thumbs up. Okay, so we came up with a superhero theme. So what I've learned and what I know is that when you develop trainings, you have to know your audience and you have to develop those to kind of excite them and make sure that they understand. So we did this in about a 12th grade, 5th grade reading level. So what it is it's Captain Germ Be Gone. And this dude, you need to help, you're on his team and you are to help him save the universe from infectious disease threats. And so what we did is that each state developed an escape room to implement hand washing, hand hygiene. It was transmission and source control, correctly donning and doffing PPE, and then cleaning and disinfection. So it starts out with a theme of, again, you are helping outwit this clutter bug and it's about saving the universe from infectious disease threats. We're asking you in teams of 5 to 6, and you'll have 30 minutes to complete the escape room. You have to stick together as a team because that's part of the exercise. And then if you need a hint, it will cost you 30 seconds to your time. So during this escape room, you'll have a facilitator. And in this escape room, it tells you your hand washing station. It gives you the supplies you need. It gives you how to set it up. And then it gives you the run through. So what makes it so fun is that you have these puzzles to put together, but you have to do so. Again, there's riddles that you have to kind of think through. You have to problem solve. So here is, on average, the nursing staff touch how many surfaces during a 12-hour shift? Well, here's the code that you need to crack it. But this same question was in the CDC Project Firstline videos and learning materials. And I guarantee that once they crack this code, you will remember. So does anyone want to take a guess? On average, nursing staff touch how many surfaces during a 12-hour shift? I know there's a bunch of nurses on here, so help me out. Take a stab at it. 50,000. Okay, so somebody said 9 something. Who's 980? What was that one? So Simbre, I'm not sure if that's how, Simbre, you are almost spot on. It's 912, so good guess. So 912. So once they open this code, then they will get into the lockbox and then they'll get this puzzle. And so they have to sing happy birthday. And it's so funny as a facilitator, you hear the group singing happy birthday and they're laughing and they're having fun. So as you go down, so here's Mr. Clutterbug. Station 2 is source control and transmission. Again, it goes you through the setup, the run through, and the walkthrough. This puzzle's backwards, as you can see. So once they put it together, they have to know, I have to put this up to a mirror to be able to read it. So it's just problem solving, and they figure it out, and they figure it out as a team. And then here's the PPE. They have to correctly don and doff PPE, and then they will get more codes and more puzzle pieces as they run through it. Again, you'll have a facilitator. To win the battle, you must be dressed head to toe in proper PPE, don correctly, safe, and you will be. Do it wrong, victory to the enemy. So again, it takes about 25-30 minutes to go through this. Here's the cleaning disinfection. And then at the very end, if they escape all of the clues, they get a puzzle piece at each one. And so the grand finale is you thought you were finished. It turns out that you're missing the important piece. Everyone plays a part in infection control. Put your puzzle together. What's the most important piece or the important thing that is missing? The answer is you. Everyone is responsible for infection prevention. So that is what we have put together for you all. We have been back and forth with the CDC, so it's not approved yet. Will be soon for us to share with you. And then Mary, if you want to bring up the slides, I can, in the last couple minutes we have left, this has been probably the most remarkable that we've had as far as our outcomes. So I wanted to kind of share this with you. We piloted it within high school students during a Casper College Career Fair. And we did a pre and post knowledge. We had 72 that completed the survey. And I want you to look at the average mean. So before the training, it was below 3%. After the training, the post training bumped up to 4%. So that's quite a jump in what they learned and what they retained. But even more so, 83% of the participants did show improvement after the training, and 84% of them reported moderately high to high satisfaction. 79 intended to implement the training, and 93% would recommend this training to others. So again, remarkable outcomes here. And then, of course, basically everyone showed improvements and had fun with it. So the next slide, Mary, we'll go into some qualitative data for you. So again, we had opportunity for them to say, well, how will you implement this? Where will you implement this? And I wanted you to look at the middle screen top. I will use this in fast food. And I'm like, thank God. Thank you for whoever said that. And now I know that we will be safe eating at McDonald's or Arby's or wherever that person works. So I thought that was pretty cute. And then, you know, again, just how educational and fun it was. I will implement in my CNA class. I will implement in my MedTech plant program. Great team building skills. I'll use it in my field of prosthetics. So go ahead and advance to the next slide, Mary. Stay tuned. So what's next? So this was such a huge success that we are going to do a virtual escape room. So again, it's going to be the heavy lift of several states, which I know we can do, but I wanted to let you know that that's on the cuff. It'll be probably 2-3 months out, but I wanted to let you know that that's coming down the pipes. And I think that's all. I appreciate the positive comments in the chat. Thanks for having me back today. And again, watch out for more to come. I'll hand it back over to who's ever. Kyla, are you facilitating?
Yeah, thank you, Crystal. That was much more interesting than my presentation, probably.
And again, I'll send out the card, the Why Firstline, for those of you that couldn't figure it out. It does work. So I don't know. Again, get a hold of me if you can't get it to go.
All right. Well, thank you, everybody, for your attention and attendance today. If you could take a minute to do our evaluation, we have the link in the chat. And if you have any ideas for future sessions, as always, do forward those on to us. And thank you so much. We'll see you next week.